At the beginning of the year, demand for COVID-19 vaccines greatly outweighed supply. But now here in Michigan, there are more than 200,000 doses of the Johnson & Johnson vaccine set to expire in the next 4 weeks. According to the Michigan Department of Health and Human Services, there are 262,000 J&J vaccines expiring in the next month. Pfizer vaccines will begin expiring in September and Moderna shots the following month.
It's sad. As a public health person, we know that the vaccine saves lives. And the fact that we have so much vaccine available, but the rate at which people are getting newly vaccinated or completing their vaccine schedule is so slow is really disappointing.
For Holden tells me that when vaccines expire at local health departments, they are disposed of as they would be at any hospital or health center.
So there's a process in place. And we have real procedures in place for how you deal with medical and biohazard waste, which is what vaccines are considered.
The Mid-Michigan Department of Health says they have 1,800 doses of the Johnson & Johnson vaccine set to expire in the next month.
Right now, the state has instructed us to keep all expired COVID vaccine to the side. We label them do not use, and we also keep them at the recommended temperature requirements for the specific vaccine. And then we are waiting for further guidance from our state immunization team on how to deal with them when the time comes, when it's closer to the expiration date.
In Ingham County, the health department has partnered with local clinics and medical providers to minimize waste.
Lansing Urgent Care has been a really great partner in that regard, and then they can call in their patients or they offer it to people who walk in to the urgent care, and that has been significant in reducing the amount of waste.
Livingston County's health department tells me they're working with local partners to ensure minimal waste by asking other departments if they are able to use the doses before they expire. For Holden says there aren't any major local programs to relocate vaccines that are about to expire.
The problem with getting vaccines distributed before they expire is it's bigger than a local problem. Just simply moving vaccine from one community to another community doesn't solve the problem because we have more vaccine supply than we do demand right now. The redistribution of vaccine has now become a global problem. The World Health Organization, the WHO, is working on kind of a good stewardship program where some of the leading, more affluent countries are contributing vaccines to the global landscape to support countries that are under-resourced and also being hit hard by COVID.
For now, the only way to prevent wasting these vaccines is if Michiganders roll up their sleeves and get vaccinated. Reporting in downtown Lansing, I'm your neighborhood reporter, Elle Myers, Fox 47 News.